a very simple test that a doctor can do and really have an impression of what is happening on the prostate. So if it is large, he will feel it more easily. If it is painful, he will feel it more easily. And if it is rough, then he can also advise. So this is a very, very important test that as we shall see in the upcoming images. Another picture. This prostate here has enlarged generally all over, all round itself, and blocked the passage of urine. So urine becomes so difficult to pass urine. And then again, this is another picture showing the same. This is the prostate, and if a doctor is to examine using a finger, it is easier to feel this from this side. Now, what is BPH and prostate cancer? So BPH is a non-cancerous, that's why it's called benign, non-cancerous enlargement of the prostate, affecting men from the age of 50 and above, or even from the age of 45. Also, the cancer affects men from the age of 50 and above. But now the cancer is it's a disease that can spread. It's a growth that can spread and leaves the prostate and goes to distant sites and gives us a lot of complications. And the cancer usually develops, I've highlighted that in red, it develops quietly or silently, unlike BPH, because BPH presents quite early and we are able to come to hospital, or you will be able to have symptoms quite early. But for the cancer, it's usually very silent until it's very advanced. That's why we need to know how do we tell then that something could be happening. Statistics tells us that around 2,800 men are diagnosed with prostate cancer every year in Kenya, and around 1,300 of them will succumb to the disease. This is according to the National Cancer Institute of Kenya, and simply because they present when it is too late. This is very bad statistics. Half of patients that develop this disease will die from it, which is very, very unfortunate because they present when the illness is too quite advanced. What are the causes? Not known directly what the cause is directly, but some risk factors has been associated to developing this disease. Having an increased age, having an age over 50 years, like we've said, one becomes highly susceptible or easy to likely to develop this any of these two conditions. Also, if there's a family history, this is one of the cancers that we have a genetic predisposition. Genetic predisposition means if you are born by a man who has that, remember, one is always born from two parents. One is born from